Let's talk about RSV, or Respiratory Syncytial virus. RSV is a virus that has been around for a very long time, and it typically surfaces in the fall and winter months, causing symptoms as the common cold. So a runny nose, maybe some congestion, maybe low-grade fever, a mild cough, body aches, but typically that's it. But RSV causes bronchiolitis, which can be harmful or have bad outcomes for small children and infants. And the reason that that occurs is because the airway structure of small infants and children is different than the one in adults. So first of all, infants are obligatory nose breathers. So now if they have a lot of nasal congestion and stuffiness, they can't breathe, so they have an airway obstruction. In addition, the structures of the larynx are a little bit different. The epiglottis is floppier, and also their intercostal muscles that help us inflate the lungs are not as developed as in older children or adults. So now if a small child or infant gets sick with RSV and they have a lot of nasal congestion, it causes an airway obstruction, which right away can cause respiratory distress in these small patients. So, and the reason that RSV has been so prevalent is because we've been doing very good over the last few years with COVID, masking, infection control, washing our hands, and those small children have not been exposed to RSV because they were just not going to daycare. Their younger siblings that they might live with have not got RSV, so they have not had the chance to build up immunity for this because we've been so protected. Now RSV is back, and especially those small infants and children are having symptoms and many times end up at the hospital. So what can we do to prevent this from spreading and to protect these small infants and children? It's the same thing that we have been doing very well for the last 2, almost 3 years with COVID, as with any respiratory illness. You want to cover your mouth, wear a face mask if you're coughing a lot. Do those good infection control measures. Stay home when you're sick. Drink plenty of liquids. Don't share anything that comes in contact with your possible secretions. So utensils, cups, plates, towels, even sheets. If you're an adult that has a mild cough and cold, you might not know that you're sick with RSV. Don't kiss your infant child, because those secretions, you might give them to your small child, and therefore they might become ill. You might only have very mild symptoms, but in your infant, because of these anatomical differences, they might get pretty sick. So it's common knowledge that we all know by now. We've been doing so well over the past few years with our infection control measures. So let's continue doing this, being very diligent to protect our very youngest members of the community.